Hello everyone, welcome to my channel. Today I'm going to talk about CNS pharmacology, which includes sedatives and hypnotics, a little bit about antipsychotics and antidepressants. And before I begin my presentation, I want to talk about GABA, which is an inhibitory neurotransmitter. Okay, so let me tell you why we need to know about GABA. For that, let me just show you a diagram. This is about how a nerve terminal and how the synapse is going on and what are the kind of signals that happen. Okay, there are two types of signals. That is, one has excitatory action and another one has inhibitory action. Okay, in excitatory neurotransmitters, what happens is there is an influx of, now this is the muscles, right? There is an influx of sodium ions, okay? And in this situation, what happens is action potential is reached. I'll explain about this in physiology class, but for now you have to remember that in excitatory neurotransmitters, what is happening is there is more and more influx of sodium ions. Whereas in inhibitory neurotransmitters, what happens is there is influx of chlorine ions. And what happens over here is action potential is not reached, okay? And the cell is hyperpolarized. Now, what is meant by inhibitory neurotransmitters? Example of inhibitory neurotransmitters is serotonin and GABA. Whereas examples of excitatory neurotransmitters is acetylcholine and catecholamines, glutamate, histamine. All right. So just for you guys to remember, I'll give you an example. Now imagine we have exam tomorrow. All right. So we'll be super stressed. Now this is a person who's super stressed, but immediately when you go to your exam and you start writing and then you see that you're able to recollect the answers and you're able to understand the topic and you're really able to answer the questions, your body reacts and automatically you'll be in a much more relaxed situation, right? That is happening. This situation of being relaxed, our brain is able to achieve because of GABA. Okay, we are going from a situation where we are stressed to a more calm situation because of GABA. Now, if GABA is not present, we will be very much disturbed. All right. So, what did we understand about GABA? That it is a major inhibitory neurotransmitter. I'll write down the important points. All right. And if anyone is interested in the notes, you can leave in the comments below. I can link the notes over here. So we learned that when the GABA binds to a neuron, it reduces the activity to reach action potential. Now let me show you how GABA looks like. All right. So it has 5 subunits. Alpha 1, alpha 2, beta. Then we have beta here. We have delta, gamma. Then another alpha receptor. Okay. So what are these subunits of GABA? It's basically alpha 1 might help in, for our body to go into a sleep. And alpha 2 can cause anxiety. Now, it really depends about each and every subunit. Each and every subunit has its own function. Okay. So I explained you that, try to remember this example so that you understand the GABA. So in stress, what happens exactly is excitatory neurons are being fired up. Now we need to inhibit it. So in order to inhibit this excitatory neurons, we need inhibitory neurotransmitters, right? That is when GABA comes into the picture, and the release of GABA and binding it into postsynaptic receptors, that will give an, what will it give? It will give more of a calming effect. It will make the cells more calm. That is about mechanism of action. Now, in addition to the binding site for neurotransmitters, GABA, GABA 1 has site where other drugs bind. Okay, so where benzodiazepines, barbiturates, and hypnotics bind, they are not exactly like where GABA binds. Okay, they are bind at a different site. Now we'll be talking about each in detail. Now in this diagram, you can see that benzodiazepine is binding over here, whereas GABA binding site is over here. Like I hope you can see, I'm drawing the small circles. For benzodiazepines, I'm making a star, and for barbiturates, I'm putting a question mark. So you see the site is really different where benzodiazepines are going to bind, where barbiturates are going to bind, and where hypnotics are going to bind. We are going to talk about each in detail. All right. So I'll just write some points over here so that it is easy. Now, this benzodiazepines have benzene and amine rings. They bind between the alpha and gamma subunit. You can see that it's binding between alpha and gamma subunit. All right. Now, they are not binding where GABA is binding, right? Now, what is their function is they do not open the channels as directly as GABA. Instead, binding of these benzodiazepines to this particular site over here will increase the binding of GABA to GABA binding site. Now, even though it's not binding over here, what benzodiazepines does is they increase the site of binding for GABA. Okay, at the end, what happens is there is lot and lot of influx of chlorine ions. All right. So what happens? They cause these channels over here to open and increase the influx of chlorine ions, making the area more hyperpolarized. Here you can see that it is making the area more hyperpolarized and action potential is not reached. That is when we go from a situation of being stressed to a situation of calmness. Okay. Examples is, let me just write two examples, and when I discuss in detail, I'll be writing about it. Alprazolam. So if you see Zolam, it is mostly a benzodiazepine, and chlordiazoxide. Okay. Now coming to barbiturates. Now you see barbiturates binding site is here. Okay. So where is this barbiturates binding? They are binding at alpha and beta subunits, but in a different site than that of the benzodiazepines. Now, how to remember barbiturates mechanism of action is remember it as a door. Now it keeps the door open for the chlorine to just come in. At the end, all these drugs are doing is to cause more and more influx of chlorine ions. Okay. Now, they also decrease the activity of excitatory neurotransmitters. At high doses, they mimic GABA. Now, let me tell you something. Is it better to use benzodiazepine or is it better to use barbiturates? It is always better to use benzodiazepines because let me tell you first the side effects of both the drugs. I will use a different color for side effects. Okay. So, the side effects is you have drowsiness and you have impaired motor coordination and you'll feel dizzy over here. Okay. Now, here for barbiturates also you would feel drowsy. You can see dizziness. You can see sleepiness. But main important thing is small dose can also lead to coma. Okay. Now they also cause CNS depression. You might get a question asking whether, if there is a barbiturates overdose, the patient might die of CNS depression or respiratory depression. The patient might actually die because of respiratory depression. All right. Now, why is barbiturates not preferred is because it has very low therapeutic index. Now, what do I mean by that? whatever the normal dose is there, that is equal to toxic dose. So you cannot use it, right? Because if you give any dose in the form of a normal dosage, it's going to get converted as a toxic dose. That is the reason that it cannot be given. Now we have hypnotics. Hypnotics do not cause anti-anxiety effect. They do not cause anti-anxiety effect. They only cause sleep. Okay. Now, they selectively bind to alpha receptors. All right. Example of this is zolpidem. Now, in barbiturates, the easy way to remember drugs is they all have barb mostly. Okay, like pentobarbital, phenobarbital, secobarbital. All right, so I just gave you an overview. I'll be discussing in detail. Okay, now you might also get a question: are these drugs and like let me put this question this way. So, does these drugs provide pain relief? What do you think? Do these drugs have properties that can help in relieving of pain? Absolutely no. They are only anti-anxiety in function, like for barbiturates and benzodiazepine, whereas hypnotics is only helpful in making the patient sleep well, but it is not relieving any pain. All right. So now I hope you guys have understood a little bit about benzodiazepine, barbiturates, and hypnotics. Okay. So overview is in benzodiazepines, we studied that they modulate the activity of inhibitory neurotransmitter GABA, and it is more used, and that is preferred more than the barbiturates because they have less addiction potential and they have less profound CNS depression. They have good therapeutic index and less respiratory depression side effects as compared to that of barbiturates. All right. Another important point about benzodiazepines is if benzodiazepine is given in the form of IV, example is propylene glycol, what happens is it can induce thrombophlebitis in large veins. Okay. So for dental anxiety, the preferred benzodiazepine is diazepam. Okay, 2 to 10 mg Valium is the trade name. It is given 1 hour before the dental appointment. So now we have barbiturates. Barbiturates are not used because their normal dose is equal to the toxic doses. Okay, that is what we need to remember about the barbiturates. And also, there is an important contraindication for barbiturates, that is, it cannot be given in patients suffering with porphyria, that is blood forming disease, because it will aggravate the disease. So important contraindication is in intermittent porphyria. All right. So that was about benzodiazepines, barbiturates. Now let us talk about antipsychotics. Antipsychotics are the drug of choice for the patients suffering with schizophrenia. Okay, sometimes it can be also used to, it can be given to prevent nausea and vomiting also. There is first generation drugs and there is second generation drugs. First generation drugs specifically block dopamine. Okay, and second generation drugs blocks both dopamine and serotonin. Okay, now in first generation drugs, what's happening is because dopamine is being blocked, they have side effects of, like, they have Side effects like stiffness of their muscles, jerky movement of the muscles, also called as tardive dyskinesia. Tardive dyskinesia. So, in physiology of central nervous system, we learn that there is intrapyramidal stimulation and extrapyramidal stimulation. There are tracks, and if extrapyramidal tracks are affected, what happens is there is a problem to the muscle and tone. And if it's intrapyramidal, it is going to cause defects of within the brain. Okay, so tardive dyskinesia is a disease that is happening because of stimulation of extrapyramidal tracts. Okay, so what happens? The main side effect of using first generation drugs is tardive dyskinesia can be observed. Therefore, the second generation drugs are more used because this side effect cannot be seen when we use second generation drugs. That is the reason that second generation drugs are being used. Example of second generation drugs are clozapine, whereas first generation drugs is haloperidol and phenothiazines. Okay, so this is about antipsychotics. Now coming to antidepressants. Antidepressants, what happens? How can we prevent depression? So there are some substances in our CNS like dopamine, epinephrine, norepinephrine, monoamines, histamines. These all are like feel good things. If we have them, then we'll feel good. As these become less in number, our CNS activity will be decreased. So we need to give the drugs to make sure that there is CNS stimulation. Okay, so therefore, there are three types of drugs that are given as antidepressants, that is selective serotonin reuptake inhibitors. So we are inhibiting reuptake of serotonin so that it is available. We are okay, so basically we are making sure that there is blockade of the serotonin for reuptake. So there is less recycling of these molecules. All right. Then we have tricyclic antidepressants. We have tricyclic antidepressants. We also have monoamine oxidase inhibitors. All right. But one of the side effects for all these drugs is they all have anticholinergic side effects. All right. Examples of selective serotonin reuptake inhibitors are fluoxetine and citalopram and trazodone. Whereas tricyclic antidepressants example is amitriptyline and imipramine. Then monoamine oxidase inhibitors examples is phenylazine and stronylcypromine. Okay, so this is about antidepressants. Now talking about mania depression or bipolar disorder. The drug of choice for this is lithium. All right. So now coming to general anesthetics. So about general anesthetics, why do we really give this? So it is nothing but we are trying to obtain medically controlled coma for surgery, right? Remember one thing that is very important in GA is onset of GA is inversely proportional to solubility of drug in blood. In other words, these drugs are leaky and then they leak out of blood. So there is more soluble agent in the blood. It will reach the critical stages in the brain. Okay, so just remember that onset of GA is inversely proportional to the solubility of drug in the blood. Now we have four stages: stage 1, stage 2, stage 3, stage 4. Stage 4 is when there is overdose of GA can lead to medullary paralysis. Okay, stage 1 is feel good stage, where you can see that you can observe pain relief. Stage 2 is delirium. Stage 3 is the stage that we are looking for. It is the desirable stage where you obtain surgical anesthesia. All right. Example is halothane. Now coming to Parkinson's disease. So what happens in Parkinson's disease is, in these patients, it is an example of defect in the extrapyramidal tract where there is dopamine deficiency. So you can see uncontrolled movements of fingers. You are not able to control it. Now we can say that why not inject the dopamine in the form of IV? But what happens is injected dopamine does not cross the blood-brain barrier. So what do we do? Then how can we give dopamine to the brain for these patients? There is a precursor of dopamine called as levodopa. L-dopa can reach the brain. But the main problem is what happens is it is converted into dopamine before it reaches the brain itself because of an enzyme called as dopa decarboxylase. Okay, so it is getting converted before itself. Now we have to inhibit this enzyme so that L-dopa will get converted into dopamine only in the brain. All right. So L-dopa is given along with carbidopa because this carbidopa is going to block the dopa decarboxylase, therefore allowing it to convert into dopamine only inside the brain. All right. So this is about the drug used in Parkinson's disease. Now let's have a quick overview. Now we studied over here that I have given you an example. Whenever you feel stressed, that's because there is no, all excitatory neurons are coming into action, and to cool down, GABA is going to bind and make sure that we feel relaxed. That's happening because there is influx of chlorine ions, which is going to make it more hyperpolarized and action potential is not reached. Then we studied about benzodiazepines, barbiturates, and also hypnotics. About benzodiazepines and barbiturates, their main mechanism of action is to make sure that there is influx of chlorine ions. All right. Benzodiazepine is preferred over barbiturates because its side effects are less. It has a higher therapeutic index, and the side effects such as drowsiness, motor coordination, and sleepiness and CNS depression are all less as compared to barbiturates. Now coming to barbiturates, what happens over here is the normal dose is equal to lethal dose or the toxic dose, and that's because it has very low therapeutic index and it causes very small dose can lead to coma. That's why it is not used. Hypnotics does not cause any anti-anxiety symptoms, it just causes sleep. Now we studied about antipsychotics. Antipsychotics, there are first generation antipsychotics and second generation antipsychotics. And antipsychotics are used in patients suffering with schizophrenia. And then first generation antipsychotics block only dopamine. And you can see side effects like tardive dyskinesia. In order to get rid of this tardive dyskinesia, second generation drugs block both dopamine and serotonin, and we can see that there is no stiffness of the joints. That is, tardive dyskinesia is not seen in such case. Now coming to antidepressants, we have three of them: selective serotonin reuptake inhibitor, tricyclic antidepressants, and monoamine oxidase inhibitors. All right. And for mania depression, lithium is being used. In general anesthetics, the main desired stage is what you need to remember. It is stage 3, and in stage 4, it happens because of overdose. Parkinson's disease mainly happens because of there is deficiency of dopamine in the brain, and injected dopamine does not cross blood-brain barrier. So therefore, levodopa can be used, which is a precursor of dopamine. But what happens with levodopa is it is converted into dopamine before it reaches the brain because of dopa decarboxylase. So this enzyme needs to be inhibited. So therefore, L-dopa is given along with carbidopa, which makes sure that the dopamine is reaching the brain. So that is all about CNS drugs. And in case you have any questions, you can leave a comment below. And if you want me to make any specific videos, you can always let me know. And please let me know if you have enjoyed. And in case you did not subscribe to my channel, please like, share, and subscribe. Thanks for watching.